Now, I'm kind of an old school guy, okay? I went to dinner last night with these guys, and I worried about who was going to pick up the check, okay? I worried about who was going to pay for it. DC doesn't seem to worry about who's going to pay for anything these days, but I worry about it. And the way they tell us they're going to pay for it is they say they're going to tax the rich, okay? Now, I'm going to teach y'all a new dance tonight. It's called the Washington, D.C. Shuffle. And I want everybody to do it with me. And I'm going to turn around like we're in aerobics class. I want you to look left. Everybody look left. And I want you to look right. My folks, you have seen the rich tonight. You are the rich that they are talking about. Now, how's the other way they want to pay for this? They want to cut the fraud, waste, and abuse out of Medicare and Medicaid. Y'all heard that one?
Cut the programs then.
I got an idea for them. Why don't they cut the fraud, waste, and abuse out right now? But see, you and I know when we think about the fraud, waste, and abuse. Think about a bunch of guys up in D.C. not doing anything, telling us all how to live. My concern is that their definition of fraud, waste, and abuse are sick and old people. That's really what I'm afraid of, that what they mean is sick and old people. So, the reality is, we're in the fight of our lives. Once government can tell people when they can go to the doctor and when they can't, they have stole every last bit of the precious liberty we call, the precious liberty we have as Americans. And are we going to let them do it? That's right. So before you leave today, I want you to do three things. Three things. Number one, over here at the tables, that Larry's helping me pass them out, you got a petition. It's a little blue petition. It's our Hands Off Our Healthcare petition. I hope everybody will fill one out. It's very important. I need everybody here to fill one out. Even if you're with your husband and wife, you can both fill one out. Try to put all your complete information, email, and everything else, because we're going to turn it over to people that need it. Number two, over on the tables, we've got some call sheets. I guess down here we've got some of y'all would be in Walter Jones's district. Some of y'all would be in
Walter Jones, good guy.
Yeah, okay, you're Walter Jones.
Walter Jones here.
Yeah. And some of y'all in Butterfield's district. Well, let's respectfully call those guys and let them know how we feel. But the most important call I want you to make is to our freshman U.S. Senator Kay Hagan. Now,
oh boy,
you certainly can call Senator Burr and let him know that you appreciate his free market health care ideas. But at the same time, it's Senator Hagan we need to work on. We need to, Senator Hagan has expressed some reservations about this whole public plan. And I think she's right to have reservations about the public plan. The public plan is hilarious because they say it's going to create competition between the insurance companies and the, the government's going to create fair competition. But you know, the government sets the rules. The government taxes private insurance. The government tells the private industry how to work. I mean, the idea that that's a fair fight is like sending George Foreman into a boxing match with a set of gloves and his opponent going in there with a couple sticks of dynamite. I mean, it's not a fair fight at all. So I hope you will call Kay Hagan. Actually, I want you to do something for me. Take out those cell phones right now. Take Kay Hagan's number. Now, they're not going to be in the office on a Saturday, but go ahead and program in those numbers. Raleigh, Greensboro.
Make sure you guys fill those out. We need it today.
Program them in, and we got the sheets over on the table. Actually, a lot of your phones have a little gadget that, and if you don't have it, we'll get you those numbers. A lot of those phones have a little gadget that allow you to set up an alarm to chime. And I actually set mine at 10:23 in the morning. See, I was born at 10:23 in the morning 19 years ago, okay? So, and if you don't know how to work that little alarm, there's a 9-year-old over here that can tell you how to do it. All right, she'll help you out. So set that so it reminds you to call Kay Hagan Monday and Tuesday and Wednesday until you get through. Okay, can you do that for me? So 3 things. Number 1, I need everybody to fill out those petitions. And I need you to do that now because we got to get down the road to Greenville in just a few minutes. Number 2, get that number programmed in. Get that number for Kay Hagan and make sure you make those calls on Monday. You might be able to call in and leave a message over the weekend. All right, nope. All right, all right. Okay, we'll get you the number. We have some sheets with those numbers. We'll get them to you. Number 3, there's a little web thing right here. It's on the signs. It's on your fans. And it's actually, sir, if you move over just a little bit, it's on the bus right here. It says, join Patients First. What I'd like you to do is, I'd like you to send I'd like you to send that web thing out, Join Patients First. I'd like you to write a note to all your friends. Chad, can I have one of those? Has that got the number on it? All right, let me give you that number to her Greensboro office, because that's where the most people work. It's 336-333-5311.